In this series, we are here to help you clear your NMC CBT exam. Every alternate day, we'll present you with 20 multiple-choice questions and their answers to boost your knowledge and to supercharge your progress. We've got a weekly master video with a whopping 120 MCQs. Don't miss out on this opportunity to excel. Let's dive right in. Question 61. Which of the following are signs of anaphylaxis? Option A, swelling of tongue and rashes. Option B, dyspnoea, hypotension and tachycardia. Option C, cold and clammy skin. Option D, all of above. The correct answer is D. Question 62. When will you consider giving out information off the patient? To a police officer. Option A, if he has a rank of an inspector. Option B, if safety of the public is at risk. The correct answer is B. Question 63. An overall risk of malnutrition of 2 or higher signifies Option A, low risk of malnutrition. Option B, medium risk of malnutrition. Option C, high risk of malnutrition. The correct answer is C. Question 64. Which of the following is not a component of end-of-life care? Option A, resuscitation and defibrillation. Option B, reduce pain, maintain dignity. Option C, provide family support. The correct answer is A. Question 65. How much urine should someone void an hour? Option A, 0.51 ml per kg per hour of the patient's body weight. Option B, 2 milliliters per kg per hour of the patient's body weight. Option C, 30 mls. Option D, 50 mls. The correct answer is A. Question 66. Patients usually urinate at night. Nurse identifies this as Option A, polyuria. Option B, oliguria. Option C, dysuria. Option D, nocturia. The correct answer is D. Question 67. The nurse has made an error in documenting client care. Which appropriate action should the nurse take? Option A, draw a line through error, initial, date, and document correct information. Option B, document a late addendum to the nursing note in the client's chart. Option C, tear the documented note out of the chart. Option D, delete the error by using whiteout. The correct answer is A. Question 68. What infection control steps should not be taken in a patient with diarrhea caused by Clostridium difficile? Option A, isolation of the patient. Option B, all staff must wear aprons and gloves while attending the patient. Option C, oral administration of metronidazole, vancomycin, fidaxomicin may be required. Option D, none of the above. The correct answer is D. Question 69. In DVT, TED stockings affect circulation by Option A. Increasing blood flow velocity in the legs by compression of the deep venous system, thromboembolism deterrent hose. Option B. Decreasing blood flow velocity in legs by compression of the deep venous system. The correct answer is A. Question 70. Which finding should the nurse report to the provider prior to a magnetic resonance imaging MRI? Option A. History of cardiovascular disease. Option B. Allergy to iodine and shellfish. Option C. Permanent pacemaker in place. Option D. Allergy to dairy products. The correct answer is C. Question 71. What percentage of the air we breathe is made up of oxygen? Option A 16%. Option B 21%. Option C 26%. Option D 31%. The correct answer is B. Question 72. The signs and symptoms of ectopic pregnancy accept Option A. Vaginal bleeding. Option B. Positive pregnancy test. Option C. Shoulder tip pain. Option D. Protein excretion exceeds 2 grams per day. The correct answer is D. Question 73. Which layer of the skin contains blood and lymph vessels, sweat, and sebaceous glands? Option A. Epidermis. Option B. Dermis. Option C. Subcutaneous layer. Option D. All of the above. The correct answer is B. Question 74. A wound care management plan should be done with what type of wound? Option A. Complex wound. Option B. Infected wound. Option C. Any type of wound. The correct answer is C. Question 75. What is meant by Gillick competent? Option A. Children under the age of 12 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Option B. Children under the age of 16 who are believed to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Option C. Children under the age of 18 who are believed not to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. Option D. Children under the lawful age of consent who are believed not to have enough intelligence, competence, and understanding to fully appreciate what's involved in their treatment. The correct answer is B. Question 76. Except which procedure must all individuals performing nursing care must be competent at? Option A. Hand hygiene. Option B. Use of protective equipment. Option C. Disposal of waste. Option D. Aseptic technique. The correct answer is D. Question 77. In nonverbal communication, what does SOLAR stand for? Option A, squarely, open posture, leaning slightly forward, eye contact, relaxed. Option B, squarely, open-ended questions, leaning slightly forward, eye contact, relaxed. Option C, squarely, open posture, leaning forward, eye contact, rested. Option D, squarely, open-ended questions, leaning slightly backwards, rested. The correct answer is A. Question 78. How do you remove a negative pressure dressing? Option A, remove pressure, then detach dressing gently. Option B, get TV and nurse to remove dressing. Option C, removes in a quick fashion. The correct answer is A. Question 79. Functions should a dressing fulfill for effective wound healing? Option A, high humidity, insulation, gaseous exchange, absorbent. Option B, anaerobic, impermeable, conformable, low humidity. Option C, insulation, low humidity, sterile, high adherence. Option D, absorbent, low adherence, anaerobic, high humidity. The correct answer is A. Question 80. Which of the following is no longer a recommended method of mouth care? Option A, chlorhexidine solution and foam sticks. Option B, sodium bicarbonate. Option C, normal saline mouthwash. Option D, glycerin and lemon swabs. The correct answer is D.